From June 1st, the Ministry of Health and Wellness will introduce a 24-hour polyclinic service at the Winston Polyclinic at Jemmotts Lane, St. Michael, and the David Thompson Health and Social Services Complex in the Glebe, St. John. This new initiative is a welcome addition to the island's healthcare system.
The 24-hour polyclinic service is designed to deliver a key aspect of medical care which has been absent thus far from the public service. That category of care would be urgent care. Urgent care lies in a spectrum between what we consider to be emergency care and what we consider to be routine, preventative medical care. Urgent care, by definition, would be medical care seeking to address complaints that, while not an emergency, meaning while they are not life-threatening, limb-threatening, or threatening to a person's vision, however, require prompt medical attention for a good outcome, ideally within a period of a few hours. Certain examples of urgent care would include accidents, minor cuts, injuries from falls, moderate breathing difficulties such as exacerbation of asthma, persons that would have fevers, persons that would have symptomatic infections, any person with vomiting, diarrhea, or dehydration, just to give a few examples. We would advise that in the event of a true emergency, meaning gunshot wounds, you have deep knife wounds, severe chest pain, strokes, should still be dealt with at the Queen Elizabeth Hospital.
The reality is Barbadians are accustomed to rushing to the A&E at night when they are not feeling well and might be hesitant to change. The Ministry of Health, however, assures the public that the staff are ready and willing to handle these urgent care cases.
The Ministry of Health, in the interest of the public, made sure that all the medical staff and nursing staff for the polyclinics were introduced. In addition to their basic training, they did an 8-week intensive course, which they had to pass exams, by the way, of working in an emergency setting, because we don't want to operate that if somebody came to the polyclinic and we weren't able to handle it, that we should be able to start some form of care at that place. So all the officers have been trained and they have been certified because that was important to us. As we move forward, we are making sure that not only there's training, but we are also working towards having better diagnostic services at these clinics. So for example, persons coming to the clinics will be able to have their routine bloods done on site and immediately. So that's one of the things we invested in, because many times to make a quick diagnosis, we need to have your blood chemistry and your hematology, etc. So that will be able to be done on site. Yes, I think that we look forward to this type of service. As with any service, it's a new service. And let me tell the public that, to me, the main challenges of developing this new service were two. One, to make sure that the security at those two clinics are tight in terms of having a good security presence. And we have scaled up. We've done a lot of infrastructure work, and there will be 24-hour security guard services at the clinic. The other thing was to make sure that we had the correct skill mix of staff, and that took some time. But I think we're on track. The reason why we did this, as I said, is to make sure that healthcare is more accessible in the short and medium term. Obviously, as with any new service, we'll have to evaluate it, and we're going to learn every day from where we at, and where there are changes to be made, we will certainly put those in place as we see fit.
As mentioned, the urgent care service will deal primarily with walk-in complaints. Persons are reminded that they should keep their regular scheduled appointments with their doctors. Persons are also reminded to have their medication and comply with existing medical advice, as you do not want to create an emergency or an urgency by lack of compliance with medical advice.